Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina Carew, and Dr. Dominique Vanier. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements.
Welcome to another episode of Team Gut Girls. Today's episode is about one of the most misunderstood topics in gut health, fungal overgrowth. So if you've ever searched your symptoms online, you've probably come across, endless claims about Candida or Candida overgrowth. And equally, probably just as many people saying that Candida is not real. So we're going to talk about what's actually true, and we're going to separate today the science from the internet myths.
So a lot of our listeners and even our patients that we see can understand this. So imagine you've treated SIBO 3 times. You're eating all the right things. You're following the instructions that your naturopathic doctor gave you, but your bloating won't budge. And you've noticed that sugar seems to make everything explode within minutes. So you're starting to see a different correlation. Could something other than just bacteria be involved in your symptoms?
So today we're talking about intestinal fungal overgrowth, what it is, who's affected by it, how it's different than bacterial, and why the conversation might be coming more mainstream. And then we'll also touch on things like biofilms, which are part of fungal colonization, which is like maybe why you've even treated fungus, but it's not going better. And today, this morning, I actually had a call with the patient. We were talking about fungal overgrowth in our son. And so he's on the autism spectrum, and he has been on fungal supports for, I think, almost 10 years. And so he rotates through different ones. And we were talking this morning about, why aren't they working, or why don't they work for a longer period of time? Because she's really changed his diet and there's really anything feeding it, and his stress levels are pretty manageable. And we were actually talking about, ironically, histamine, which is in our mast cell episode, as being, maybe he is more predisposed to kind of histamine type symptoms. And he did some genetic testing that showed that he was more predisposed. And so he's not able to share. So he's nonverbal. And so we were talking about could we try some histamine type things to see if the fungal supports work better, to figure if we could get further down the road. And so keep in mind that even though these topics are all separated, lots of times you might be experiencing more than one of these things. And so there may be some overlap into both things that we talk about today, but we've talked about in the past. So let's start with what is Candida or intestinal fungal overgrowth. So there's this idea in mainstream medicine that talks about Candida being like a tongue thrush or a yeast infection or athlete's foot toenail infection, like a skin fungus, something where we can see. And this idea of intestinal fungal overgrowth is actually having something on the inside. And that is not always being shown through the skin, but it could be shown through the skin. And the fungi and bacteria, they naturally live within our intestinal tract, in our gut. And they should exist in some type of balance. We do need these. So we need bacteria to break down and make good, strong, helpful microbiome. And then when we think about fungi, we know that they're definitely fed by sugar and carbohydrates, but we also know that they help to break down sugar and carbohydrates. So everything in moderation is always good for us. The problem becomes when our fungal category becomes overgrowing. And so there are some things like Candida or small intestinal fungal overgrowth or large intestinal fungal overgrowth or intestinal fungal overgrowth that we might hear, and they're sort of like interconnected. Some of them like orient to like where it might be in the body. How much of that do we know for sure? It's really hard. This isn't something that we can easily test. And so some of this is really about clinical practice and asking good questions. But one of the things that, or my discussion this morning with that mom was like, well, why is this even happening? Like, where does it come from? And so we know that we all are born with some fungal. We might have more because our mother at the time might have had yeast or Candida overgrowth. So we might just have inherited more to begin. Maybe there was an instance, I had someone yesterday where the mom had been given antibiotics during childbirth, and the child was given antibiotics 48 hours after being born because they had an infection that had been transmitted. So we know that that child started off life with like sort of this detriment to the microbiome to already begin with. We know that when things sit more, when we talked about gut motility and the movement of the gut, that ends up being a reason why things accumulate more, because it's not moving out in the way that we expect it to. Things like digestive issues where we're having like medications like PPIs, which are blocking the acid, which would typically break down some of the fungi, or immune dysfunction where a body has an immune system that's fighting something else and so can't also keep this piece under control. Maybe changes in stomach acid based on not just medication, but aging. We may have a bacterial overgrowth and we had taken an antibiotic, or we had an experience where we had to do something to get rid of that bacterial overgrowth, even if that's herbal based. And in killing off the bacteria, we have let other things grow in its place. I always think about this. Our front lawn when we first moved into this house was just weeds. And so one day I like pulled all the weeds out and literally it was just dirt left. And I was like, okay, I'm just going to like plant grass seed, or I'm going to put down sod. And we had gone away for the weekend and we came back, it was all weeds again. And I was like, man, like I did all that work. But it's so fast, right? And if we think about that as part of our gut, same thing can kind of happen, is that we remove something, and if we don't replenish or replace it, so we take antibiotics, but we don't put in the good probiotics, or we're not putting in those prebiotic fibers, then the most opportune thing is going to. And so bacteria and fungi are sort of this like busy highway, and everything that gets stuck on the busy highway becomes a part of our being that is part of what we're trying to get rid of, or maybe not necessarily get rid of in its entirety, but calm down the overgrowth. So we have a lot of myths around Candida. What are some of the ones that you have heard?
I'll start. I'd say one of the most common myths is this, I will call it denial, like Candida, it's fake. And you really want to think of this like Candida is real, but we're thinking of it like when given the opportunity, it will overgrow, as in it's an opportunistic species. And I really like the analogy there of like the garden, right? So when given the opportunity, that whatever that plant was is going to overgrow some of the other plants that are in the garden. So when we think about Candida and other fungi, they absolutely live normally in everyone's digestive tract. And the question isn't whether like that fungus itself exists, but the question is whether it's growing in the wrong place or in excessive amounts.
And now the opposite side of that conversation is that, okay, you read about Candida, you read the symptoms, which we'll go through, like bloating, brain fog, all these other pieces, maybe a skin rash. And you think, okay, every digestive problem is Candida. Just like when we were in school learning about it, all of my instructors were sold on Candida. So as you're probably picking up on the series of this podcast, bloating is complex and it's caused by many different overlapping things and sometimes multiple things at once, right? So these symptoms can overlap heavily with irritable bowel syndrome, with small intestinal bacterial overgrowth, or SIBO, food intolerances, constipation. So we're thinking that motility issue, things are slowed down. And there isn't and with all of these things, there isn't one symptom that automatically means fungal overgrowth. We really need to think about what's going on in the person. How did it lead to this? Do they have those risk factors like long-term PPI use or stomach acid issues, motility issues? But its symptoms are very vague sometimes. So let's go through those right now. Starting with bloating, obviously. So abdominal discomfort can be one of them, excess gas, looser stools, diarrhea, nausea, and then that brain fog can be one of those systemic or additional symptoms that we're seeing. But yeah, so all of these things can overlap, and research has found that there's no symptom that uniquely distinguishes fungal overgrowth from bacterial overgrowth or other common digestive disorders.
Myth number 3 is that all Candida is, and so that's probably a bit of a misconception as well. So it's not that we don't want to have any of it, and there's probably never a way for us to remove any one type of bacteria from our intestinal tract. It's so complex and so difficult to measure. But we know that like Candida does live naturally in our digestive tract. It's part of our microbiome. Research suggests that many people, like I think the number that I saw was like 70% of people, healthy adults, have fungi in their system. Candida is one of those species. So the goal is never to annihilate everything. We're not trying to treat the body like cancer patient where we're trying to like get rid of their immune system entirely and rebuild it. We're not trying to do that. We're trying to make sure that there isn't too many weeds in the neighborhood. And can it be one of the residents without taking over the entire neighborhood in terms of its function? So a lot of gut stuff throughout all the talks that we've had really is about finding the balance that's right for you in your body and the things that are going on. And so, so one of the things we can start talking about, and when he started about this, is like Candida is symptoms, and certainly a lot of the symptoms that she recently shared are things that we also see in lots of other conditions that we've already talked about that are related to bloating. And so how do we know if Candida is a piece of that? And so I would say part of that is asking good questions about patterns. And so things like, when did this start? Have you had to have repeated courses of antibiotics? And repeated courses might be one infection that you had to switch antibiotics for because the infection didn't clear, or maybe that you have like close infections together. So we have some patients, for instance, that get urinary tract infections every month. Are you taking any medications that would affect digestion, or surgeries that would have affected digestion? Do we have any flaring after certain foods? So Dr. Whitney alluded to sugar. So sugar might be one where, I feel so crazy after I eat sugar, or carbohydrates, or I get more itchy. I have a patient earlier this week that when she eats chocolate, her butt gets itchy. And so we're like, okay, well, like what kind of chocolate is it, right? Have you been treated for a type of gut infection that maybe didn't get improvement or got improvement for a short period of time? And then certainly like some of those things, are we seeing yeast elsewhere in the body? Do we see jock itch? Are we seeing yeast infections? Are we seeing athlete's foot? Are we seeing patches of skin that either don't tan or they're really red or irritated? Some women will notice under their breasts or areas where the skin folds that they'll get sort of irritation and issue. Dermatologically, sometimes we see it around the mouth. So we'll see like lots of almost like the Joker lips, where like sort of around the mouth, we're seeing a lot of redness or irritation. Some people will also get like dandruff in their hair. And so when we start seeing something on the outside of the body, I always think about it as it's something on the inside trying to get out. And our skin is our biggest detoxification tool, especially when our intestinal tract isn't working very well. So we're not getting things out through our stool or through our urine. So, fungal overgrowth may have this outside component, someone has, toenail fungus, but it may also have this inside component of medications or things that have happened.
Yeah, that's really helpful. And certainly, like we've talked about, there's a lot of overlap, right? So this kind of investigative hat that you're wearing as a practitioner is really important because we're seeing all these non-specific overlapping symptoms with other conditions. So let's talk about what symptoms actually raise suspicion.
Sure. I'd say some of those ones that Whitney talked about earlier, so like the bloating, gas, discomfort, diarrhea, nausea. So those are always like something's going on that we need to investigate, whether that's fungal or bacterial or otherwise. Brain fog is a big one. Lots of sugar cravings can be a big one. So I had a little girl in my practice that we were pretty sure that she had like a sort of this recurring yeast. And her parents couldn't figure out where she was like getting it from because they'd really calmed down her diet. And her dad was mowing the lawn and found all these candy wrappers outside of her window. So she had like gotten candy, ate it, and like tossed the wrapper out of the window so that her parents wouldn't know, but like didn't realize they didn't always blow away. And so some people, well, kids are incredible.
I love that.
You guys are incredible. Oh yeah. I also had another little girl that was getting like recurrent vaginal yeast infections, and she was 4. And so oral thrush, anal itching, worse with sugar, worse with alcohol, worse with carbs, carb cravings. And so they're not really an exclusive list, right? We can see a lot of those things with other things, but what we're trying to start seeing is patterns. And so like any other GI disorder, often people have more than one. And so that's more when we're thinking about treating someone, are we giving them also tools that may address this at the same time?
Yeah, that's awesome. Question, how do you distinguish or what's the difference between SIBO, so the bacterial overgrowth, versus this fungal overgrowth?
Yeah. Basically, they seem like the same thing. And so when we think about the SIBO testing, which we had talked about in the very beginning of the episode series, we talked about how like the test is sort of not always as accurate because we have to think about, who's doing the test, what's the information they have, is this the right test for them? And it would be amazing if we could say, oh, and we can just tackle on this fungal piece of the test. But from our understanding right now, we don't have a gas that we can measure from fungus that really tells us that it's there. And so I don't know what you guys do, but in my practice, when I see someone with SIBO, I kind of just assume there's going to be some level of fungal there. And so when I'm thinking about, what are the ways that we can treat it, I'm always including something in there that is like more of an antifungal piece of it. Sometimes those types of herbs or antibiotics will like cross over and also address bacteria. And sometimes we have to just add something else extra. And I think that they're so similar. I don't think we could actually really separate them. Do you guys do the same thing in practice, or do you do something different?
Yeah, that's why I like sometimes the rifaximin or the antibiotic is very indicated, and it's nice because it's this bit specific to the small intestine. But that's why we love our antimicrobial herbs too. So using these in combination and switching it up a little bit because they are antifungal and antimicrobial. And it's not, like Dr. Christina said, not just clearing everything out, which can be helpful.
Yeah, same thing, right? Like the herbs will have multiple actions. And sometimes they even cross over to like helping with the nervous system, because we know with patients that have dysbiosis, which is like the collective term that their microbiome has shifted unfavorably, often we're seeing like, not always, but often we're seeing like a mental health piece to it because it can be really distressing. So we want to calm the nervous system. So it's pretty cool. Like herbs will cross over many different areas, which I find is a little bit different than pharmaceuticals.
I would say like also one of the things, like, I don't know about you, but I see lots of people in practice who have been put on like, say, doxycycline for 3 months for their skin. And one of the things that I will always encourage them to do is take like nice statin antifungal medication at the same time, because the patients that don't, we seem to get this bloating kind of fungal overgrowth pattern by the time they're finished the antibiotics or even partway through. But if we can mitigate it earlier on, we might even be able to avoid it. And so sometimes it's like a thing that you've done for a completely different reason. You're like, oh, I want to clear my skin up, or I want to get rid of this tick bite that I just got because it's crazy rampant tick season. But if we're not considering like, well, what are the outcomes of that antibiotic on the other side, we're kind of setting our patients.
Mm-hmm. Mm-hmm. Which is, maybe a good transition into like the diagnosis part is tricky. And Christina, maybe you can talk a little bit more as to like the testing when we're thinking that somebody may have a fungal overgrowth.
Yeah. So there is some, like in some of the research, they talk about taking fluid from the small intestine on an endoscopy and be able to test that to see if there's fungus in it. But it's a very like rare situation, especially in Canada. We have lots of criteria for people to get an endoscopy. And so it's unlikely that someone who maybe just has a fungal overgrowth from an, aggressive antibiotic use or something along those lines is going to qualify for that. Or, is it even necessary? So I would say generally practitioners use like history, symptoms, clinical experience, response to treatment. So like, oh, you took oregano on your own and that started you feeling better. Maybe that's like a bit of a clue to give us an idea of what are the things that would respond to oregano that we might want to consider. Ruling out other causes. And so that's why this sort of area becomes so controversial, because it's not really like black or white. And we know that the medical system likes things where it's like very much like, this is here because it is true. This skin scraping says there's fungus in it, therefore it is true. And because there isn't a test yet, it becomes really challenging and sometimes missed or dismissed.
Yeah, that's tough. But that's why we like ruling out other things too, right? Because the conventional system, and those are the guidelines, and then we could be more confident to start talking about this, or even continue the conversation if we started talking about it initially when you came in, to do something that, doesn't have like a black or white answer. Okay, Dr. Christina, what about Candida cleanses? And a lot of my patients ask, well, do I need to completely cut out sugar during this protocol?
Yeah, I think there's two pieces. So when I give someone a treatment plan where I'm addressing something that might include fungus, I actually have learned, maybe the hard way, is that I try to be really specific about what I ask people to do. So I ask them to like reduce as much added sugar as possible. So trying to avoid things like Coke and cake and ice cream, but not trying to cut out all the fruits unless they're eating like this massive fruit plate. It's a little bit different. Can they reduce some of the gluten out of their diet? Summer is a lot easier to do that because we have a lot more variety and it's easier to eat things without buns or bread as much as maybe in winter. And so this is maybe the prime time of year. And then can we also look at things that break down and create more glucose like dairy? And so I kind of focus on those three areas. We also know they're really inflammatory. We know that they tend to be more higher FODMAPs. So we're kind of like reducing it down. What I tell people not to do is Google every Candida diet on the planet, because what they will end up eating is blueberries and oatmeal. Because every single Candida diet is 100% different than the next one. It's like the FODMAPs plans, right?
Right.
You start or histamine plan. You start and you're reading one and you're like, well, this one said I cannot eat apples, but this one said I can. And so what ends up happening is we get in these like extreme diet situations. And I've had patients that did this, or patients that came in and said, I did this extreme diet for 6 months and then I ate some chocolate or I had my birthday party and then everything came. Well, the diets aren't getting rid of the bacteria. They're just reducing the replication. And so, there are ways that in anything, like if you had a strep infection, we wouldn't want the strep to continue to replicate as we're trying to clear it. So this is no different in terms of we're trying to reduce the replication of it, but we're also not trying to make you crazy. and not feel like you can eat anything or feel anything safely. Because we did talk about earlier in one of our other episodes about how some of these extreme diets really can cause more long-term issues. And so trying to be really moderate. So if you are doing something to get rid of fungus and someone asks you to remove absolutely every food or follow these 8 diets, it probably isn't going to help you any more than, doing some of the things that are categories.
And I know we've talked about, I think, in at least one other episode, is like when we just reduce all of our foods and try to like achieve, quote, Candida zero, Candida's smart. And so they will start to eat other fuel sources, which ends up being like the mucus layer in our intestine. And that can lead to further issues down the road. So the point of all this is like, yes, diet can help, but also we're trying to create an ecosystem where all of the species are thriving and not overgrowing.
And if you have like visceral hypersensitivity and you go to Candida zero, or, you have like low FODMAP, no Candida, you're not feeling anything, that feels normal all of a sudden. So when you start to treat it and things start moving again and there is normal gas production, but it's still technically normal, then you could think it's abnormal. So there's a bit of a dance.
So maybe we can have a little bit of a discussion about like some of the questions we get asked in clinic, and just make sure that our listeners sort of are all on hopefully the same page.
Okay, I'll go first. Question 1, why does Candida get blamed for everything online?
I think it's like what Whitney said. I think it's like a lot of people learned about it in school as being the sort of thing that caused everything. And so it's a very common thing to go to. I would say like lots of nutritionists and dietitians are probably in the same boat as naturopathic doctors, is that you know what you know. And so if you haven't tried to broaden or expand anything, you go back to the thing that you were always told, right?
And it's clickable. If there's like a list of symptoms that all mean something, and then that leads to their email list that you're signing up for, and then you're buying a Candida diet, you got to kind of follow through and see what's going on the other end.
Yeah.
And I was guilty of this when I started practice in my social media page. I'm like, ooh, yeah, all of these, like people interact with that a little bit easier because they're like, oh, I have that.
Yeah.
Yeah.
Yeah, people want to think.
It's fancy and it's easy. It's easy, right? Oh, I can point to it. I have this thing.
Yeah.
Yeah.
Okay, I think we talked about this a little bit, maybe. Can healthy people have Candida?
For sure. Everyone has it. Yeah, I don't think it's about health or not health. It's about excess. So everyone can have excess of anything, right? You can have an amount of laundry that is very manageable to do, and you can have an excessive amount of laundry to do.
That's not a fair analogy. I'm
dedicated to laundry at my house right now.
Yeah, I'm gonna.
But like anything in excess feels overwhelming, but anything in like moderation feels manageable. We can have an excess amount of stress that makes us not sleep at night, or we can have an amount of stress that we know how to make. And I think any gut stuff, there is a normal amount of bloating. We have an episode about that. There is a normal amount of stool moving or a normal amount of air coming out of our bodies. So, there's a normal amount of Candida. What that is, or how do we quantify it, I don't think we know. But we certainly know that it has some benefits, not just things. I always have people say, like, what if I just eat one piece of cake? Or what if I just have one, mocktail? Like, will this cause me to have Candida? What do you tell those people?
No, it's not just this one food that somebody has had, right? You want to think of it more broadly, like it's the system. There's something going on with the system that is shifted when somebody has the Candida overgrowth. One piece of cake may aggravate them, but it's not a causative thing. So we want to take a little bit of a step back from that type of thinking, which I think also may help people, because then it can kind of relax their food choices too.
which is important, right? Because we want to maintain a positive relationship with food and be able to have a piece of cake when we want to have it. How about this? Should everyone avoid sugar forever? I think that goes like right into what you just said, Dominique, is, not demonizing the food and looking at it from a broader perspective. I think it's good to ask how you feel after you eat that piece of cake. Like, did you feel exhausted? Did you feel brain fog and bloating and uncomfortable for the rest of the night? Well, what did you eat that evening? Did you have a glass of wine with it? Were you snacking on all the things prior to? What is the broader context of it? Okay, and finally, can probiotics help Candida or fungal overgrowth?
I actually find, so I may be on my own on this one, but I find that a lot of time because people take probiotics as this like fix everything solution, that we know that some probiotics, for instance, in bacterial overgrowth, actually make things a bit more fed. And I would say that often when people take probiotics, they get lots more gas and bloating. Some of that might be helpful gas and bloating. Some of it might be harmful gas and bloating. And so we certainly know Candida has a relationship, which we think with Saccharomyces species. And I always think of that like sort of like take the plant out, take the weed out, put the grass back in, put the Saccharomyces back in. But I don't know that it's the only one. Like, what are you guys finding in the probiotic space?
I'd say it's a pretty nuanced conversation, right? Like from a mechanistic standpoint, we know probiotics can crowd out other species and then lead to a positive symptom improvement, whatever we're trying to achieve. But another important point is like somebody who responds to one probiotic may not respond to another. Somebody who doesn't respond to one probiotic may do really well with another. And so for patients that actually really do have like a fungal overgrowth, is sometimes there's a trial and error that may need to happen, or sometimes probiotics are just not going to help them at all. That has been at least my experience in this. Yeah, I'm often asking, how did the probiotics make you feel? Better, worse, don't feel anything at all? How do these like prebiotic foods make you feel? And then it kind of helps guide where we start, where they're at, what they're there. And like we talked about before, right, we can't always tease out like a fungal overgrowth from a histamine issue. And we know some patients with histamine, again, like if they're reacting to a probiotic, it may not even be the Candida, it may be like something else going on. So it's really about looking at the whole person, I find. Okay, maybe we can talk about some practical takeaways. So I think an important point for our listeners is if we think we have a fungal overgrowth, try not to self-diagnose, especially from social media like TikTok. The internet really does love like simple answers, simple solutions to complicated problems. And like we've talked before, at least I have mentioned that the digestion feels like the wild, wild west sometimes. So gut health really works in this like simplistic way. So maybe if we can reframe this a little bit, we want to be curious and not fearful. The internet absolutely loves certainty. And so if somebody is bloated, for example, the internet may say, oh, it's Candida. If you're tired, it's Candida. If you crave sugar, it's definitely Candida. But, for example, like somebody may actually have a blood sugar dysregulation and have all of those things happening at the same time. So certainly getting some blood work done would be a good first step. And we want to think about our body as a little bit more complex than those examples. So instead of becoming fearful every time we experience a symptom, think of it like I'm curious. And that can also help in a way like the way the brain communicates the gut, because we're responding from, a more calm nervous system. And we want to think about starting patterns, noticing patterns too. And that, for example, would be, thinking about when symptoms happen. Are they worse after certain meals? Could they be connected to stress? Did you have a stressful day? Are you noticing an aggravation? Did they start after a course of antibiotics? And this can be any antibiotics for any length of time. Are they getting progressively worse? Do they come and go? Those are all important patterns that can help both you, and your practitioner. And so when we think about things more from curiosity, that's going to give our healthcare practitioners really valuable information. And, fear often sends us chasing quick fixes that don't actually address the real issue. And sometimes we can even do more damage if we're really traveling down that path. So we want to think about digestive symptoms like there are multiple possible causes. Like we've talked about, sometimes there are overlapping issues happening. Some people with chronic gut issues may have like a bacterial overgrowth, a histamine issue, a fungal overgrowth, something else going on. So that's why it's important to do the due diligence, work with somebody who can help and avoid jumping to conclusions.
And I really like what you just mentioned is like switching your brain to being more curious and how that calms your nervous system. And you can just be more of an observer instead, because we can be really in our heads and in our bodies about it and fearful, which is scary. And then we tend to latch on or try to latch on all these answers where it could be more complex than that. So I thought that was really good to reiterate. And then you mentioned the patterns too. So we always get our patients to do this. And I think in every episode, we're getting our listeners to do this. Is really start tracking your symptoms. In a previous episode, we talked about hormones. So tracking it with your cycle, tracking if that pizza cake made you feel bloated and brain foggy and what else did you eat that day, timing, bowel habits, bloating patterns, bloating timing, bloating location in your abdomen. So high up, middle or lower down. Are you noticing itching too? Are you noticing rashes? We just mentioned that antibiotic history, what medications, proton pump inhibitors. So we will always be asking you this. So then, and sometimes patients get annoyed when we're asking onset questions over and over because we're so curious, but getting me more curious about timelines and when this started and what else is going on. Because these symptoms are clues. It's not always black and white. I always say every body is different. So we have to get curious and be open-minded about all the possible things that could be going on. And one of the biggest mistakes we can make is assuming a symptom equals a diagnosis. We might be chasing something that can make things worse down the line if we're not considering all possible options. Bloating, gas, constipation, diarrhea, or brain fog are your body's check engine lights. It's letting you know that something's off. Something isn't quite right, but it's not specific. So it's not telling you exactly what it is, which is super annoying sometimes and overwhelming. So we have to be curious and think about these symptoms as puzzle pieces. One piece on its own doesn't show you the whole picture. You need the surrounding pieces like your medication, your lifestyle, your diet, your medical history, your stress, your sleep, your social interactions, your work. Are you starting school? Are you in the middle of your master's thesis? All of these things really show up in the body and in this ecosystem too. So instead of asking what supplement treats bloating, ask, why am I bloated in the first place? This question will lead to much better answers.
Yeah, looking at it from a biopsychosocial model, it's not just about take this pill, see you later, you're going to feel better. We have to look at the entire person, how they interact with their environment, and also what's going on internally. I think a third takeaway is really about the person's history. And what I mean by that is like if they maybe have tried to do like repeated treatment for SIBO, the small intestinal bacterial overgrowth, without lasting improvement or possibly without any improvement, it may be worth switching gears and discussing the fungal aspect or a fungal overgrowth. Definitely with an experienced practitioner would be at least my recommendation. But also not assuming that that's the answer either. So again, this curiosity element rather than I know that this is the answer. Gut health really is about balance. It's not about going down the rabbit hole of eliminating things, whatever species we're trying to eliminate. And I would say this is probably one of the biggest mindset shifts that can be helpful for people who have like chronic long-standing dysbiosis. So our goal really isn't to create a sterile gut. That is absolutely not what we want. It's really to create a resilient one. And when we talk about like what a resilient gut is, that is where we have diverse species and many species. And so when we're talking about like food choices is we know from the research that people who are eating a very diverse diet tend to also have a diverse microbiome. Like the foods and the different types of foods that we eat are very protective for us. And, when it comes to our digestive tract, it's home to trillions of bacteria, fungi, viruses, like other microorganisms that all play a role in keeping both our gut healthy, but our entire body healthy. And so when we hear words like Candida, or, the instinct may be, oh, I need to kill it. But health is absolutely not about wiping everything out. Like we talked about, it's the environment, it's restoring balance. And you think about our environment around us and nature, and that itself is about balance. There's a role for every plant and every species in it, and the gut is no different. And that's why we say to eat the rainbow, get out there in the gardens with your hands and get in the soil and really eat things in season and switch it up, all the different colorful fibers, instead of just shopping in the aisles of the grocery store. Try to diversify your ecosystem. Okay, so another takeaway is gut health is rarely about one organism. It is this ecosystem and restoring this balance. So Candida isn't the villain. That bacterial overgrowth isn't the villain. And it's tempting to look for one thing to blame or find that list of symptoms online and click it and think that that's what's going on, even though it can be. So if I could just get rid of Candida, all my problems will disappear. But in our clinical practices, it's not that easy. I really wish it was. So one person might have all of the above. So slow gut motility, a history of antibiotics, has been on proton pump inhibitors. They have a lot of food sensitivities. They have chronic stress, don't we all? Hormonal changes, fungal overgrowth. This could all be included. So where do we start? Gut health is usually a story with multiple chapters, not just a single villain. And that's why good practitioners are more curious what organism is present. They ask, why did this environment allow that organism to grow in the first place or overgrow in the first place?
So as always, we try to give you some ways to talk to your practitioners about the things that you might be experiencing, or if you're curious about, is this a piece of your puzzle? And so, we know that people are prone to dismiss Candida as a possibility. Calling it intestinal fungal overgrowth actually sometimes helps. But it may also be going into the situation and say, even though we've tried these other things, could there be another explanation for the bloating that I'm experiencing? You might not remember, but we had that time when I took all those antibiotics from the dermatologist, or, I had taken that PPI for a period of time. Is fungal overgrowth something that I should be worth considering? Or how would you decide when treatment is appropriate? So kind of asking them in a way where you're giving them the information. I would say laying the seed and hoping that practitioner that you're seeing will help. The goal at Team Gut Girls is always to help you ask better questions, and we want you to feel empowered. And sometimes it's really hard not to want to go into your appointment, regardless of what the practitioner is, and say, I definitely have Candida. Because as soon as you're so certain about something and the person that you're seeking advice from doesn't feel like an expert anymore, they're very bound to shut you down, even if you're right. It's because a lot of this is really about relationships and dynamics. And so if you can position it in a way no different than when you were a kid trying to convince your parents to let you ride the bike further down the street, you're not like, I can do it. You're like, well, I went this far with you before, or I did this with you before, and therefore this might give you some more confidence. So it might be saying, I have had a history of toenail fungus or yeast infections. I have had, we did treat using this type of antibiotic for this skin rash that I was having. Maybe this is a piece of the symptoms that I need to consider. So how do you help the practitioner in front of you try to investigate more instead of just becoming focused? And even if they come up with something and it isn't Candida, maybe it's given you an opportunity to start the conversation and remind them of some of the things that have happened. We all see lots of patients. We do our best to remember everything we can about you, but we might have forgotten that when you were 15, you took a whole bunch of antibiotics for your acne. But you reminding us is actually really helpful.
I will just say, remind me about, right? Because it's true. We do see a lot of chronic and complex cases in practice. And so having those reminders is helpful. And I think that that's what I love so much about these conversations is they're not about giving people another label to worry about. They're about helping people really understand their bodies a little bit better.
And our goal isn't for people to become gastroenterologists. Frankly, we don't want to become gastroenterologists. We want people to investigate and understand how their health works more and not feel like there are only miracle treatments out there. And if the miracle treatment didn't work, then, their life is forever more full of bloating. That there are lots of different reasons that you might be experiencing this, and having meaningful conversations with your healthcare provider or finding a healthcare provider that lets you have those meaningful conversations is really helpful. And so, remember, fungi are first naturally in our gut. Overgrowth is different than having just a normal amount. Lots of the symptoms overlap with other gut conditions, so it's not always very clear cut, which means diagnosis can be a challenge. The internet has lots of things that make us think that the only way to heal ourselves is by restricting, and we know that's not going to help. And you want to look at someone who takes your information and considers it, but then also looks at the broader idea. They're not just like, yes, you do that, you want that, I'll just give it to you. You want them to have a meaningful discussion with you about whether that is or isn't the case. And that's really what we are all about, and helping you to get more information to ask better questions. So thank you for joining us.
Yeah, thank you so much for tuning in on another episode of Teen Gut Girl. And we really hope you are become more curious and you've had some more questions answered in terms of fungal overgrowth or Candida, because better gut health changes everything.
Thank you for joining Teen Gut Girls. Like, follow, subscribe, and share a podcast with friends you think will want to know more about their gut. You can also visit us at teengutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.